May I come in?
Yes.
Alright. Hello, I'm Riley. I'm going to be your nurse today. I'm going to perform hand hygiene, and I'm going to shut the door. Can you tell me your name and birth date?
Ty Ralphgard, 10102.
Good. And where are you right now?
At home.
Good. What do you have for breakfast this morning?
Pancakes.
Good. And what is the holiday that is coming up?
Easter.
Good. You are alert and oriented times 4. Your mood seems calm and appropriate, and your speech seems clear and appropriate. So the next thing I'm going to test is your cranial nerve 7, which is your facial nerve. If you could puff up your cheeks, purse your lips, smile without teeth, smile with teeth, frown, and raise your eyebrows. Good. Your cranial nerve 7 is intact. The next thing I'm going to do is test your cranial nerve 3, which is your ocular motor. Good. Your pupils are equal, round, and reactive to light. Next thing I'm going to do is have you keep your head straight and follow this pin light. Good. Convergence is what I was testing for there, and I didn't see any shaking of the eyes, which would be any signs of stigmatism. So the next thing I'm going to test is the 6th field of gaze. So if you can follow my fingers without moving your head. Good. Cranial nerve 3, 4, and 6 seem to be intact. The next thing I would do, if I had it here, was do a Snellen chart. So I'd have you stand 20 feet away from the chart, and I would test your far side of vision. I would also test your near side of vision with a Rosenberg test. So you would hold it 14 inches from your face, and I would test your nearsighted. So the next thing I'm going to do is your whisper test, which is testing cranial nerve 8. So I'm going to whisper a 2-syllable word in your ear, and you have to repeat it for me.
Baseball. Softball.
Good. Your cranial nerve 8 is intact. The next thing I'm going to do is the Romberg test. So if you could stand up for me. All right, I'm going to have you close your eyes and keep your arms straight. I'm going to test for balance. I'm going to stand here to make sure the patient doesn't fall. Good. There's no sway. You can sit down. There's no sway, which means that you have good balance. The next thing I'm going to do is look at your external ear. So I'm going to check for any redness, swelling, tenderness, or drainage. Good. I'm going to pull on the pillow. Is that tender at all? No? Good. Your external ear looks good. Next thing I'm going to do is test your nose. So if you could occlude one nostril and sniff for me. Good. And do the other one. Good. Your nostrils seem to be patent bilateral. Can you look up for me? All right, good. Your septum looks midline. Next thing I'm going to do is test your cranial nerve 1, which is your olfactory. If you could occlude one nostril and close your eyes and tell me what you smell.
Basil.
Good. And close your eyes and do the other one.
Garlic.
Good. Cranial nerve 1 is intact. Next thing I'm going to do is assess your buccal cavity. So if you could just open your mouth, I'm going to look at your oral mucosa. Good, everything looks pink, moist, smooth, with no lesions. Can you show me your teeth, please? Good. It seems that you have 28 to 32 pearly white teeth. No decay, they are attached firmly to your gums, and there's no signs of dental appliances. Next thing I'm going to do is assess your tongue. Can you stick it out for me? Good, it looks moist, moderate in size. No lesions. The ventral surface looks smooth. Can you open up your mouth a little bit? Good, ventral surface looks smooth, pink, and with veins, so that is normal. Next thing I'm going to do is look at your uvula. Can you open up your mouth? Good. There's no pink or exudate, and it hangs freely and in the midline. Next thing I'm going to do is look at your tonsils. So can you open your mouth one more time? I'm going to look for the shape and size. Good. The shape and size looks appropriate. There's no redness or exudate in them, and there's no swelling, so that's good. Very normal. Next thing I'm going to do is test your cranial nerve 9 and 10. So could you say ah for me? Good. The soft palate and uvula rose at the same time, which is normal. If I were to test his gag reflex right now, I'd be testing cranial nerve 9 and 10 as well, and I would stick something at the back of his throat, the posterior pharynx, to see if he would gag. And if he did, then the cranial nerve 9 and 10 would be intact. The next thing I would do is have him drink some water to make sure he swallows, his voice isn't coarse, and everything is symmetrical. So the next thing I'm going to do is test your cranial nerve 12, which is your tongue. So if you could stick it out for me, move it up and down, and side to side. And if you could push against the side of your mouth, and I'm going to apply pressure. Good. Good. Everything looks intact and symmetrical. Next thing I'm going to do is test your cranial nerve 5. So if you could clench your teeth for me, I'm going to palpate these muscles, and they seem equal bilaterally, and muscle or cranial nerve 5 is intact. I'm going to, if you could stand up for me, I'm going to palpate your muscles to make sure tone and symmetry is symmetrical. Good. Upper, lower. The tone seems symmetrical and bilateral. So you can sit back down. If you could hold your arms out, I'm going to test for muscle strength. Can you resist? Good. And resist. Feet up for me. And I'm going to pull up. Okay, good. Your muscle strength is at a +5, which is really good. The next thing I'm going to test is your cranial nerve 11, which is your accessory. So if you could shrug your shoulders. Good. I'm going to apply resistance. Can you nod your head and shake it no? Good. Cranial nerve 11 is intact and bilaterally equal. Do you have any joint pain at all?
Mm-mm.
No? Can I palpate for any redness or inflammation? Good. Knees. No redness or inflammation. And obviously no pain, which is good. Next thing I'm going to do is assess your gait. So if you could stand up and walk from that side to this side. Good, and you can sit back down for me. You had erect posture, which is good. Coordinated movement. Your arms swayed symmetrically and moderately and in opposite directions, which is good. So your gait looks great. Last thing I'm going to do is test for your range of motion. So I'm going to start with your upper extremities. So if you could stand up one last time. And if you could show me flexion of your arms, of your shoulders, I mean. Good. And extension. Good. And can I see adduction and abduction? Good. Can I see external rotation and internal rotation? Good. And circumduction, which is a full circle. Great. Now I'm going to test your hips. So can I see flexion, extension, and hyperextension? Good. Can I see abduction, which is this way? And abduction this way. Abduction, adduction. Good. And internal rotation and external rotation. Good. Everything seems great. You have any questions for me?
Nope.
Good. You are all done. Thank you.